Hello friends, I'm going to discuss with you very important topic today, and that is eating disorder. Do you suffer from eating disorder? Do you really know what is eating disorder? Think. You may be suffering from eating disorder and you may not be knowing it at all. You know, some people, most of the people actually they suffer from this disorder and they don't even know. Now, one thing we actually do is we eat according to a certain timetable. This is actually okay, but I believe that you eat when you feel hungry. But if you make a timetable, you will feel hungry at the same time. That is also true. I have tried it practically also. I've eaten at different time intervals, but every time when I fixed a time in a day or so, it actually became my timetable and I felt hungry at that same time. So following a timetable is not actually wrong also, not bad also. It can help you a lot, so you can do that also, but it is not necessary. Keep in mind that you eat when you feel hungry, right? But it doesn't mean that you skip your meals. Breakfast, something is very important which one should always have, right? So let us look at this disorder which actually people are not very aware of, not very familiar with. It is a disorder and it is actually a serious mental health condition, and that too by due to abnormal eating habits that negatively impact an individual's physical and mental well-being. Get it? Right? So it may be because of your eating disorders only that you may be suffering your physical problem or mental problem, and there are different types. Actually, I'll be discussing them one by one. So different types are there, and the first one is anorexia nervosa. Anorexia nervosa, actually people actually suffering from this, they have a fear of gaining weight. They just have a fear that if whatever they eat, they will gain weight, and they will have a distorted body. That means they want a V shape or a glass shaped body, and which may or may not be true with everyone. Not everyone is blessed with that, right? But they have a fear that if they eat, they will just lose their figure, and they'll just gain weight. So they have this kind of fear, and they may severely restrict eating at all. They don't eat at all. They don't take. They may not, and they may also engage into excessive exercise and use other methods also to reduce weight. And interestingly, what? Vomiting. They vomit out, and then they can take some laxatives to lose weight also. And that despite the fact that they are significantly thin, they're underweight, but still they think that they will gain weight, and they do all such things. So anorexia nervosa is actually eating disorder, right? So you may relate with yourself or with someone you know. You can put it in the comment box so that we can have further study and on it and see how many people suffer from this. It will help us to understand more and have my research on this further, right? So you can just mention in the comment box if someone you know is doing this, or you may be doing it or yourself also. So you can just put it there. And luckily, these disorders can be cured. And one of the cure is your hypnotherapy, right? I'm a hypnotherapist, so I would be recommending hypnotherapy, but it's not necessary. It's your choice what you want to do. Then comes your bulimia nervosa. Bulimia nervosa actually is another disorder which people suffer and they are not aware of it also. Something similar to anorexia, but let us see in detail. Now, what happens in this case? In the first one, they were not eating. In this case, they eat a lot. People, they just hog. And during the this condition, they consume large amount of food in a short period of time. You know, just hog on, hog, eat. And it is followed by purging behaviors such as self-induced vomiting, fasting, excessive exercise to compensate for what they have eaten. And for the binge eating episodes they have gone through, binge eating, I'll come to binge eating also, because that is the next disorder. And like anorexia, individual with bulimia may also have a distorted body image, that is in their mind actually, and experience intense feelings of guilt or shame surrounding their eating behaviors. So they may be suffering from guilt also, due to the eating disorders they have. They eat a lot, and that too very fast and in a very short period of time. So bulimia nervosa is another issue, that is another disorder. And if you think someone is related with this, or you may be related with that, sometimes it happens that you're very, very hungry and you just want to hog on, just want to eat. You know, after eating 25% of your appetite, you're actually satisfied. And for overweighted like me, I am overweight, and I'll come to that later on. But I have reduced a lot from what I was, but it's okay. So I'm just on it now. Those who are overweight, they when they eat a lot, and when they feel hungry, they eat a lot due to some reasons, maybe because they feel something from inside, burning sensations they have, they just want to eat, and they have a guilt that time, and they go for excessive exercise, and because of weight they may actually land up into some issues. I've seen a lot of people suggesting to reduce weight in a lot of ways, I can tell you. And a lot of programs are there to lose weight, to manage weight. Just some people say intermittent fasting. Fasting is not a solution, I can tell you. You should never fast, right? Never fast in the sense, you can do your rituals like when you fast, it's okay. But it doesn't mean that you don't eat anything, right? Fasting doesn't mean that you just give up everything, even water also. So there, after a gap, maybe after a gap like Ramadan, you have a little gap, not little, it's a big gap you have, but you eat after that, right? So you can have little breaks of that, but all in all, it is not recommended to have fasting for reducing the weight. To reduce the weight, if that is the aim, then you should not be fasting at all, right? So fasting is not a solution to reduce weight. It is only exercise. You simply walk and you will reduce weight. And hypnotherapy definitely can help you, because what we do in hypnosis, we actually train the brain in such a way that it will eat only 75%, 75 or 80 or even 70% of your appetite, and rest is taken by the fat which is inside you, right? So we can do that. And also, like you have some addictions, addiction to have cold drinks, addiction to have pizza, addiction to have burgers, some actually fast foods which actually are affecting your health, your weight. And some people have the addiction to eat sweets. Eating sweets or pizza or burger is not a problem at all. But if you're only eating that, and too much of that is going to affect your health, right? So we can do that in hypnosis, we can do that. But anyway, so let's talk about more. And again, if you find yourself related with this disorder, you can drop a message so that we can understand. I can develop my database and I can use it to understand the thing more and educate people more. It will be helpful for the society and for me also, being an AI expert also, so I can actually use the data to do some predictive analysis also based on that, and disease also, prediction of the diseases also. I've been working on that also. Anyway, so let's come back. So another one that the word which came in the previous one, that is your binge eating. Binge eating disorder, that is bed disorder. It involves recurrent episodes of binge eating without purging behaviors. In purging behaviors, you were vomiting, but here you don't do anything. And individual with the BED, that is binge eating disorder, they feel a lack of control over their eating. That is what I was telling you. They have addiction. And during these episodes, and they may eat large quantity of food. And even when not physically hungry, they are not hungry, but just I want to have, forget, eat it. Just want to check, okay, fine, this is good. Yeah, okay, I'm liking it. Eat it. Oh, good, eat. Gain weight. This actually can lead to a feeling of distress, guilt, and embarrassment when you don't fit in the dresses, the dresses you like most. Then you really have some embarrassments and you don't like yourself and you have a guilt. So it's better not to do all this. And let's talk a little more on binge eating, because this is something actually concerning. It is a pattern of eating characterized by consuming large quantity of food, as I said earlier also, but in a short period of time. And the feeling of a loss of control, actually, you lose the control over eating. You just eat on. Unlike other eating disorders such as bulimia, nervosa, individuals who binge eat, they typically do not engage in compensatory behaviors such as vomiting or excessive exercise, or they don't want to make up. They just eat. Oh, lie down, eat. Oh, great, feeling so good. Now, binge eating episodes are often accompanied by feeling of guilt. Guilt is there, shame is there, distress is there. Now, individuals may eat rapidly and to the point of discomfort. Oh, the dresses are not fitting. You eat so much that the dress just want to come out of your body, even when they are not physically hungry, but they just keep on eating. Now, this disorder, it is a specific eating disorder which is characterized by recurrent episodes of binge eating. That is recurring. It's not that only once it has happened, it keeps on happening. And that is the problem. Once in a while, okay. Once in a month, 2 months, 3 months, you eat like that, maybe, okay. But if it is a regular habit, then it is a problem. So, uh, like once in 2 days, once in 3 days, once in a week, that is a problem. So, it is most common eating disorder in USA, United States, and affects both men and women, all ages, though it is more prevalent in women. Sometimes it's interesting, but women are more conscious about their health and their weight, but when they are suffering from binge eating, I'm really sorry to say, they are not able to control themselves, and this is a mental disorder that they may not accept, or they may not like to accept it. Now, what are the factors actually which are which are connected with this disorder? And they include genetic predisposition, psychological factors such as low self esteem or body image, dissatisfaction, history of trauma or abuse, and societal pressure related to weight and appearance. And sometimes people just eat because, okay, I'm thinking I'm eating, I'm working, I'm eating. You don't want to eat, but you're eating just for the distraction, just for the sake of it. And that is actually not the right way of eating. And that is why it is a disorder, right? Eating can be a disorder also. Now, this type of eating can have a physical and emotional consequences. like your obesity. And once you're obese, it is really really difficult to come down. I know I suffered from it, so I know it is very difficult to come out of obesity. So if you cross that limit, it's difficult to come out, but you can come out, that is for sure. Then you can have diabetes, heart diseases, depression, anxiety, all sorts of things you can have. And treatment for binge eating disorder, it often actually is a combination of a therapy such as cognitive behavioral therapy, CBT, we call it CBT, or hypnotherapy, you can say that, or interpersonal therapy, talk and do that. And it may include nutritional counseling also. Nutrition, definitely. Nutritional counseling is required. Even if we do uh, hypnotherapy, we would recommend that the person goes for nutritional counseling also, right? Now, if someone you know is suffering from this, again, I would like to say that please put it in the comment box. This will help us, me rather, to understand how many people are suffering. It can help me in creating a database, and I can work on it, and I can actually do my research and get back to you with a proper treatment using hypnotherapy. Although I'll be coming with a video, there is already a video of losing weight using hypnotherapy, but I can come with more ideas, more videos on this, so that you can come out of these issues. Now, the next one, that is other, it can be specified feeding or eating disorder, OSFED, we can call it OSFED. Yeah, this actually is a range of eating disorder symptoms that do not fit in any of the three above. Now, this category, it may include atypical anorexia nervosa, that is where individuals are underweight but do not meet all criteria. There are certain criteria which they may not actually fit into. Then we are having purging disorder, that is where individuals engage in purging behaviors without binge eating. They go into purging, but they don't have the binge eating disorder. And other variations are also there. Distortions are there, behaviors are there, eating behaviors are there, disordered eating behaviors are there. So eating disorders are interesting actually, and we have to work on it. And hypnotherapy can help you. My video is there to lose weight using hypnotherapy. You can actually watch it, but keep in mind, whenever you're watching any hypnotherapy video on my channel, please make sure that you're not doing anything. Make sure you're not doing anything. You have free time. You are able to lie down somewhere or sit in peace where nobody is there to disturb you, right? And uh, drink water, a little bit of water, or a glass full of water before you actually listen to it. So you'll have to actually, you may fall down, you may meet with an accident if you are driving or doing something. So it is recommended that when you're watching any hypnotherapy video on my channel, please do not do anything. Follow the instructions carefully, which will be there in the description. There is a video also on that, so keep watching that. Okay, now this disorder is a physical or psychological consequences, and malnutrition can be there, electrolyte imbalances can be there, gastrointestinal, sorry, gastrointestinal issues can be there, that is related with your intestines. Heart issues can be there, depression, anxiety, social isolation can be there. So it's essential to seek professional help. So you can come back to me, drop a message, and I can take a one-to-one session also, or there will be some videos on this very soon. One is already there, so I'll be putting more on this. and can help you to overcome these disorders, right? So put some comments on uh, this video. If you like the video, just like it, or if you want to put something in the comments, please put something in the comments so that I understand that okay, you know someone, or you yourself could be suffering from this disorder. Don't be ashamed of this. Yeah, even I actually used to do suffer from some of that, but now I have understood it. So when I have understood it, so I know how to control it. And being a hypnotherapist, I know how to control myself, so I can control others also. If I have reduced, others can also do that easily. It's not a rocket science. It is not a rocket science. You don't have to go for any type of dietary plans, or intermittent fasting, or excessive exercise. Exercise is required, yes, for your limbs, not to reduce. It will in the actually end of the day, it is going to reduce also. So but the aim should be to tone up your muscles, right? And have a healthy life. So I wish you a very, very healthy life. If you like the video, please subscribe the channel. Subscribe the channel to have more interesting videos like this. And if you will subscribe, you will have more videos to control eating disorders, to get cure of eating disorders. Very soon the videos are coming, so you will be enjoying this a lot. So subscribe the channel, like the video, and put the comment. Please don't forget to put the comments. Have a nice time, have a nice day. Subscribe the channel. Thank you.